Hello, my name is Candice, and I am Dr. Morwood's practice manager. It is very important to choose the best location for your surgery. Dr. Morwood will take a few moments to review the 3 most common options for your upcoming procedure.
As you know, I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and I have over 20 years experience in plastic surgery. One of the most important considerations and one of the most important decisions we can make prior to your operation is the proper location where you're going to have your procedure. What I'd like to do is take a few minutes today to talk about this very important issue. To review, there are 3 places that we offer, 3 locations that we offer where you can have a procedure, a plastic surgery procedure. Number 1 is the office, number 2 is the surgery center, and we're very lucky that there's a surgery center right downstairs in our own building, and number 3 is the hospital. I'm the chief of the division here in Monterey, and I have full privileges there in plastic surgery. So we can offer you those 3 choices for your location to have your plastic surgery procedure. In summary, we offer 3 locations for your plastic surgery procedure. Number 1 is the office, number 2 is the surgery center, and number 3 is the hospital. In the office, in summary, you get pills for oral sedation, also a narcotic, an antibiotic, and oftentimes an antihistamine like Benadryl. You are sedated and numbed up, but you're awake. At the surgery center, an IV is started, there's an anesthesiologist there and a nurse. You can get those medicines right into the vein, and you can tell the anesthesiologist how deep you want to go. Anything from twilight to sedation to a deep general and stages in between. At the hospital, that's for longer, more complicated operations. There's an anesthesiologist there. You can get a general anesthetic. You can stay overnight. And if you have any uncontrolled medical problems, that's probably the best way to go, is to go to the hospital. Also, if you're having a procedure that is both combined insurance and part elective cosmetic, it's probably best done at the hospital. So now that I've gone through a capsule summary of the 3 different choices, the office, surgery center, and hospital, let's take a more in-depth look at those 3 options. Let's start with the office. First of all, in the office, we do relatively straightforward operations that don't take too long, in general 4 hours or under. We do not start an IV. We don't have an anesthesiologist here in the office. But what we do in the office, a person comes in and you start by taking pills after your vital signs are checked, of course. So these pills include a sedative, you take that by mouth, a narcotic, that's a painkiller. You take an oral antibiotic, of course, that helps minimize chance of infection. And then most people also get a Benadryl, that's an antihistamine, that will help dry you out just a little bit, and it makes people a little sleepy. So again, let's review. You take pills by mouth, a sedative, a narcotic, an antibiotic, and most people take a Benadryl. We let those medicines take effect. So we want you to be quite mellow and relaxed by the time we go to the next step, which is numbing up the skin. You'll be prepped with something called betadine, that's an antiseptic. We put sterile drapes, there's a monitor, etc. And then we numb up the skin. Now, numbing up the skin stings. It hurts because I use a needle. And depending on what procedure you're going to have, it stings to have your skin numbed up. But then we let the numbing medicine take effect, and so the skin is numb, and so then we numb up the deeper tissues with a very dilute solution called Hunsted's formula. And then we let that soak in. So by the time all that takes effect, you're very mellow and relaxed, you're numb, but you're awake. Now, when I say you're awake, some people will take a nap in the procedure chair or on the procedure table just because they're relaxed and they're feeling mellow and they're laying down or in an almost horizontal position, and so they take a nap. But certainly if we talk to a patient while they're sedated, certainly they can respond and they can get up and walk out if they need to, or they certainly walk out after the procedure. So they're conscious but very relaxed, and they're numb. So that's the office. We have a great autoclave, sterile instruments, plenty of betadine, sterile drapes. We have a pulse oximeter We're constantly monitoring your oxygen saturation and your pulse. We take your vital signs beforehand. But that's in the office. We don't have an IV started, and there's not an anesthesiologist present. It's primarily for people, first of all, who can tolerate being numbed up while they're awake, and for people who can relax. You need to be able to relax and keep still and have a procedure that may last anywhere from a half an hour to 4 hours. Most people, if you're honest with yourself, you know if you can tolerate going to the dentist, or do you need to be put to sleep for a dental procedure, etc. So you have some idea whether you can tolerate or not being numbed up. But the office is for relatively straightforward procedures that don't last too long. And it's really a requirement, if you're going to have a procedure in my office, that you have no uncontrolled medical problems. We really believe in safety first. No uncontrolled diabetes, no uncontrolled high blood pressure. If you've ever had a heart problem, if your lungs are not in perfect shape, it's best really not to have a procedure in the office. So it's for healthy people, or people whose medical problems are controlled, who are capable of relaxing and getting numbed up, and who are capable of sitting still.
Choosing the proper location for your surgery can be confusing at times. We are more than happy to answer your questions and help you feel comfortable about the choice that you and Dr. Morwood make.